morning. I'm Ciro Rinaldi. I'm a consultant haematologist at United Lincolnshire Teaching Hospitals and also Honorary Professor of Haematology at University of Lincoln. I started a molecular laboratory in hematology malignancy back in 2014. We started as a very small team, and then we grew over time, and now we have a number of PhD students, master students. The aim of the lab was to look into diseases and cancer of the blood that are currently incurable, particularly focusing on myeloid malignancy. An example of that is myelofibrosis, which is a aggressive myeloproliferative with neoplasms, or myelodysplastic syndrome, a condition that can, over time, progress into acute leukemia. Those conditions are incurable, and for that reason, there is a requirement to understand more of what are the pathways implicated in the progression of those conditions. My lab focus on transcription factors, pathways that might be affected, that we can understand better and potentially target with new drugs, but also looking into the interaction between the cancer cell and the immune system and how we can interfere in this mechanism and potentially help to cure those conditions in the future.
Hi, my name is Annie Squires. I am doing my PhD here at the University of Lincoln. I am working within myelodysplastic syndrome, looking at how anti-CD47 blockers interact with the tumour microenvironment. And I'm now doing a direct co-culture, which is looking at phagocytosis within the tumour microenvironment. So within a flask, we are just looking at the cells together, seeing how the anti-CD47 blocker impacts phagocytosis and also with normal chemotherapy agents. The hopeful result of this research will show that within the tumour microenvironment, if we get a successful drug within a anti-CD47 blockade, we can then successfully cause phagocytosis of these cells and treat the cancer.
We genuinely believe that research is a core function of health and social care. Hi, I'm Professor Jaspreet Phull. I work in Lincolnshire Partnership Foundation Trust, which is the mental health trust. I'd like to talk a little bit about mental health research. We have an incredibly bold vision because we recognise that there's a clear need to act on the best evidence-based practice for our patients and the people of Lincolnshire. We also recognise that we in Lincolnshire can be leaders within the field of rural and coastal mental health care for the UK. We genuinely believe that research is a core function of health and social care. At present, we're very excited because we're collaborating with the university and other stakeholders in terms of developing a mental health research group bid. Central to all of this is really our commitment to multi-professional development and support to improve a diverse range of research involvement, and really believe strongly as an organisation, as a system, that research and innovation can provide the right evidence to drive better treatments.
The essence is to ensure and to support research that's really grounded in practice. Hello, I'm Lorna Leaston and I'm a Senior Public Health Officer at Lincolnshire County Council and work to support a corporate programme of work to realise our ambition to become a leading council for research and innovation. As a local authority, we know that research activity, including findings and evidence, is integral in improving the support and the services that we provide to our communities. Our Lincolnshire Health Intelligence Hub provides a shared evidence-based resource for health and social care professionals in Lincolnshire and supports the building of that solid evidence base that's so vital in understanding and addressing local issues and priorities within Lincolnshire. Our aim is for all local authority employees to be research aware and to grow research interest and engagement. We have strong working relationships with the University of Lincoln. The benefits are mutual, bringing research closer to practice, generating new research knowledge that's relevant to service users and local communities, supporting knowledge exchange and enabling us to strengthen our local authority research culture. Areas of research interest and expertise include gambling-related harm, digital exclusion and prevention.
We're trying to understand how to improve pain management for children and young people who require an ambulance. My name's Greg Whitley. I'm a paramedic research fellow with the East Midlands Ambulance Service and an associate professor in paramedic science at the University of Lincoln. I'm currently on a NIHR postdoctoral fellowship, and as part of that fellowship, I'm delivering a study called the PANDA study. The PANDA study is looking to improve pain management for children and young people, and it consists of 4 different phases. So the first phase is a realist review, where we are synthesizing all of the relevant documents around pre-hospital pain management in children and trying to work out what works well for which children. The second phase of the study is recruiting children and young people, parents and carers and ambulance clinicians, hearing their stories and experiences and trying to understand what works well for which children. The third phase will be to do something called consensus workshops, where we bring all key stakeholders together around a table to decide which components of an intervention we want to put together to try and improve care. And it's probably going to involve some kind of education and training for paramedics and ambulance clinicians. So once we've done that consensus work and we've developed our new intervention, we'll move into the 4th and final stage of the PANDA study, which will test the feasibility of this intervention, and we'll roll this intervention out to a small number of ambulance clinicians to test whether it's feasible to do a larger trial in the future.
It's not just about, well, that works. It's about saying this is the evidence to say this works. Hey, I'm Eleanor Jeek. I'm the service manager of the mental health services in the community across the East and Coastal Services. I'm a mental health nurse, and clinically I feel strongly that we can see the benefit of physical health and physical activity on mental health. And so I was really excited and honoured to be able to be the PI of a piece of research we're doing at Skegness and in the future in Boston to look at physical activity with the Spaces programme and those with severe and enduring mental ill health. The aim of the programme is to offer an 18-week course of physical activity to encourage individuals to engage in that process, engage in exercise, and monitor the benefit of their health and their mental health from that. I feel really honoured and excited to be the PI because it helps me promote research. It helps me promote that lived experience of what research can do for our health and the services we offer, and making those services better. And it's not just about, well, that works. It's about saying this is the evidence to say this works. And the team can then see the importance of research in their day-to-day clinical activity.
We need real-world solutions developed in real-world settings, and I think primary care needs to be an integral part of our research. Hello, I'm Dr. Majid Akram. I'm Deputy Medical Director for Lincolnshire ICB in primary care. I've been involved in innovation. I've developed a platform called VMDT. Now, this is a digital tool that streamlines multidisciplinary collaboration. It improves chronic disease management and reduces the workload burden on our frontline teams. So as an innovator, I would like to share my learning with other professionals. So we need to build a culture where new ideas like this are valued and where innovators are supported, not isolated. Innovation has to be part of the day job and not an optional extra. So let's make Lincolnshire a place where research and innovation are embedded, encouraged and owned by every part of the system, especially in primary care and community care. There's a famous saying, it says, the best way to predict the future is to create it. And that's exactly what we should be aiming to do.